Doctors in Asia are calling for more people to be vaccinated against typhoid. They're worried about the growing number of cases of the disease and want immunization programs to become a priority. Well, the World Health Organization estimates that 21 million people contract typhoid fever each year. Of these cases, there are at least 200,000 deaths annually, mainly among school-age and preschool-age children. About 90% of the deaths happen in South and Southeast Asia. Well, Dr. Christopher Nelson is the director of the Coalition Against Typhoid, a group which works to save lives through vaccination, and he joins me now in our Singapore studios, but he's based in Washington, D.C. Dr. Nelson, thank you so much for joining us. Basically, you have most of the cases happening in South and Southeast Asia, but you also have some South and Southeast Asian countries which have successful typhoid vaccination programs, but you also have problems in the Philippines, Nepal, and India. Why so?
Well, I think we've seen that in China, Vietnam, and even in Thailand. Countries have had national discussions about their burden of typhoid fever, and they've taken action to vaccinate and protect their populations against it. But other countries, despite regional priorities, haven't translated that into a national discussion. And we're here to facilitate that national discussion.
Why haven't they discussed it on a national level when they've agreed on it on a regional level?
It's not clear. Sometimes the pathway to installing the policy is not evident to everyone. Sometimes there are competing priorities. There's already great progress being made with polio in the region. Measles is a priority. And typhoid is also a local and regional priority that needs to be discussed.
Most probably the stakeholders are not all on the same page. You have the medical societies, you have the government, and the lawmakers who basically all have their different priorities for national health.
That's right. There are many issues to be discussed, and it's our job to work with the local stakeholders, the pediatric societies, the medical societies, parliaments, and others, to bring them together and have this discussion and decide where typhoid fits in their agenda.
But among these three countries, Philippines, Nepal, and India, which among them have really made progress in terms of implementing this vaccination process?
Well, as I said before, China, Vietnam, and even New Delhi and India have had a discussion, and they're implementing programs, and they're very successful. But there are other areas within India, other states that have to have this discussion. In Nepal, they're making slow progress, but we're still working to bring additional stakeholders in and have a discussion there. Certainly in the Philippines, they recognize there's a burden. We hear week after week that there are outbreaks in different parts of the country, and we're working to bring those stakeholders together there as well.
Could it be a budgetary problem or international funding? That's why they haven't really taken off with their vaccination programs?
Well, there's no question that at the international level, typhoid vaccination is a priority, but there are still some gaps in the funding to support the country's implementation of programs. The countries themselves, though, also have to have this discussion, and they also need to prioritize budgets in support of typhoid vaccination, in addition to their other vaccination priorities.
We'll have to leave it there. Thank you so much for joining us on Newsday. Dr. Christopher Nelson, Director of the Coalition Against Typhoid.
Now, a curfew has been declared